Welcome. In this video, we're going to be talking about critical thinking. As our textbook authors Dunn and Hope put it, what we're trying to do here is build a philosophical toolkit. Within medical ethics, we are working within the realm of arguments and reasoning. And because we're working within this realm of arguments and reasoning, we want to at least have a couple of moves at our disposal, a couple of strategies to make good arguments. So I want to talk about what's sometimes referred to as the fact-opinion distinction and the concept of conversation stoppers. Then we'll take a closer look at 4 of the skills of philosophical reasoning that Dunn and Hope mention in their chapter. So here's the first thing I want to mention, and this goes beyond what's in the textbook, but I think it needs to be talked about. It's something that happens a lot in the realm of public discourse and discussion about ethics, is you'll hear an argument being criticized as saying, that's just a matter of opinion. We don't have to listen to this person, they're just giving opinions, not facts. This functions as what I and some other philosophers have referred to as a conversation stopper. And in a philosophy class, I need to really impress this upon you. You can't critique arguments this way. There's a wonderful video by the philosopher John Corvino on the fact-opinion distinction. And that video points out that the fact-opinion distinction, in many ways, is sloppy. It's unclear. Sometimes, when we talk about something as an opinion, we're talking about things that are people's values. But on the other hand, sometimes we're talking about things that can't be proven. So sometimes, for instance, people will talk about the belief in God. Whether or not God exists, to a certain extent, is a matter of opinion. But that doesn't mean that there's no right answer to the question of whether God exists or not, right? So the other thing that's even more problematic about just saying that's a matter of opinion is the issue that when somebody says, well, that's just your opinion, or that's just your opinion, man, well, that sort of shuts down the conversation. It says, I have decided that I think that your argument is just talking about yourself, and I don't have to listen to you. This is functioning as a conversation stopper. And there are other examples of conversation stoppers out there. So sometimes you'll hear people say, you only believe that because, you only believe that because you're a Christian, or you only believe that because you're an atheist. Or you only believe that because you're part of the medical profession, or you only believe that because you've been brainwashed by things that are skeptical of the medical profession. These are not good ways to do the work of philosophy, which is to talk about whether certain points of view have good reasons behind them. When you say you only believe that because, you're saying your reasons for an opinion aren't even worth listening to. Another version of a conversation stopper is to say, I don't have to give reasons for my own opinion, right? People say, I have the right to my own opinion. Well, this is a pretty weak approach as well. It's not a very philosophical approach, because we would like to think that to the extent that you have a certain point of view, a certain way of looking at the world, a certain set of values, well, it's a good thing to be able to back up your point of view and back up your values with particular reasons. When people say that they have a right to their opinion, oftentimes they're using it to insulate themselves from criticism or challenging questions about their opinion. And it's true that we can all have our own points of view on questions at the end of the day. But when we are in the field of giving reasoned arguments for and against certain opinions, you don't get to make that kind of cop-out. Now, the other way in which it's true that you have a right to your opinion is that for most opinions in countries with free speech, the government is not going to come and punish you for having a particular point of view. That's true enough, but that doesn't mean that in a philosophy classroom or just in a good philosophical discussion, you just get to shut down the conversation because you don't like the challenging questions that are being asked. Closely related to this is justifying claims with slogans instead of reasons and discussion. Now, it is true that within medical ethics, there are some slogans that have their place in certain contexts, right? Maybe you can use a slogan to sum up an argument, or you can use a slogan like if you're writing a sign for a protest. But, if you're having an argument about abortion, you can't just say, "My body, my choice." It's a good slogan, and it hints at an important argument. But you can't just say, "My body, my choice," and then say, like, "I don't have to listen to anybody anymore," or "That's all there is to it." So even with views that might be correct views, just throwing out sort of a stock phrase, that is a certain kind of conversation stopper. We can use these slogans as guides to our thinking, or maybe summaries of our thinking, but it doesn't actually replace the work that we do in a philosophy classroom. And we could look for other examples out there of ways that people sort of forestall and shut down conversation before it even begins. All right, now in our textbook, Dunn and Hope actually give us a list of 8 skills for philosophical reasoning. Here are the skills that they give us. They say distinguishing facts from values, reasoning from principles, defining your terms, elucidating concepts, comparing cases, doing thought experiments, using logic, and spotting and avoiding fallacies in reasoning. So we're going to look at 4 of these skills. But I will also note that in the work that we already did talking about euthanasia, we've already practiced some of these skills, right? So we've already worked on defining our terms. So for instance, when we learned how to distinguish euthanasia from assisted suicide, or how we learned to distinguish non-voluntary euthanasia from involuntary euthanasia and voluntary euthanasia, this gives us a way of getting really sharp on what we're talking about. In the course, I've already talked about concepts of informed consent and coercion, for instance. We've also talked about the concept of, I believe it was, give me one second, a conflict of interest, right? And we've already worked on the idea of case comparison. For instance, withholding of care versus the case of Dr. Cox. So this was the patient with prostate cancer who simply refused any more surgery or chemo, versus the case of Dr. Cox and Lillian Boys, where we learned that Dr. Cox performed euthanasia on Lillian. And then we tried to have a discussion and tried to figure out whether there was anything morally wronger in the second case as opposed to the first. So let's jump into some other skills for critical thinking that are useful in medical ethics. One thing that we can do, now this is not the distinction between facts and opinions, but rather facts and values. So a fact, Dunn and Hope say, is a way that the world is, and it's generally established through assessing evidence around us. So for instance, if we want to figure out whether a certain surgical procedure is safe, we could go to the medical journals, and we could start looking at what data we have on exactly what sorts of bad outcomes result from a certain surgery and how common they are. Whereas values, these are questions about what is important to us. So we might realize that in some cases, we might have complete agreement about the facts, but we might have disagreement about values. So we're going to notice within medical ethics that sometimes when we're disagreeing about whether a certain course of action is a good one or whether a certain policy is justifiable, we're going to be disagreeing about what the facts are, like whether a certain surgery is risky. But other disagreements are going to be disagreements in the realm of values. Now, Dunn and Hope give us a wonderful example in their book. They imagine a doctor who learns that their patient has epilepsy and tells that patient that they need to stop driving their car because this epileptic patient might have a seizure while driving, which could be harmful to people. Now, let's say the physician then sees the patient driving the next week. And we might ask the question, well, should the physician inform the police, for instance, that their patient has been driving in spite of their epilepsy and in spite of doctor's orders? Now, some people in this case say, yes, this doctor needs to inform authorities on this matter. And other people say, no, they shouldn't. Now, one argument is simply that, well, on the one hand, we have somebody who values public safety more than privacy. So we might say if you value public safety the most, then you're going to inform the authorities about what the patient has done. And if you value privacy more, then you're going to keep quiet. That's one interpretation of what's going on here. But we might notice that sometimes we might just have disagreement about the facts. So for instance, some people will say a reason why you shouldn't breach patient confidentiality isn't a matter of privacy versus safety, but it's actually that safety says you shouldn't inform the police either, because if you inform the police that this patient has been driving in spite of their epilepsy, well, this might actually cause more people to avoid coming to their doctors and talking about their epilepsy at all, right? So we might even think that sometimes we're going to be disagreeing about, the value of privacy versus the value of safety, but other times in medical ethics, we're going to have simply factual disagreements about what's going to promote the public good the best. So, facts versus values. Sometimes we need to pause, step back, and say, well, what are the facts in play here? What are the values at play here? And what are the disagreements that we might have about the facts or the values? So, here's another thing that we can use as a method for evaluating arguments rationally and fairly. Well, one thing that we can do is take an argument and we can break that reasoning into a step-by-step series of premises leading to a conclusion. So for instance, Dunn and Hope flag an argument that goes like this. It says euthanasia is a Nazi policy and it's therefore wrong. Now, what we could do in order to think a bit more philosophically is take this argument step by step. Sometimes we'll even try to be charitable, that is, interpret the argument in the most plausible way that we can in order to think about it more clearly. So if we look at this argument, we might try to convert it into a formal argument with two premises, 1 and 2, and a conclusion, 3. So 1 might be anything that the Nazis did was morally wrong. 2, the Nazis practiced euthanasia. 3, therefore, euthanasia is morally wrong. Well, with this line of argument, we can actually say that this argument has a good logical structure, right? Now, when we talk about a good logical structure, sometimes philosophers will call this a valid argument. Valid in this context means if premise 1 is true and if premise 2 is true, then it's logically impossible for premise 3 to be false. Right? So a good logical structure is one where if you truly think that anything that the Nazis did was morally wrong, and 2, that the Nazis practiced euthanasia, if you believe these 2 things, then logically you have to believe 3. Right, so that's what we're talking about, good logical structure. Now, the next thing that we can do after we've made a logically structured argument is we can then ask not just what would follow if the premises were true, but whether the premises actually are true. Philosophers and logicians, they like to make the distinction between a valid argument, that just means good structure, versus a sound argument, which means it's an argument with good structure, but it also has true premises. Well, we can start to ask questions about A, whether anything that the Nazis did was morally wrong. So one thing we could do there is we could come up with what philosophers call a counterexample, right? If you can tell me one thing that the Nazis did that was not morally wrong, premise 1 would be false. So for instance, if some Nazis were vegetarians, reportedly Hitler was often a vegetarian, wasn't a perfect vegetarian, I'm told. But we might say we could imagine a Nazi being a vegetarian. Would that make being a vegetarian wrong? Well, we might actually think, no. What makes being a vegetarian a good or a bad choice? Whether it's okay or required or forbidden? Well, we'd have to look at what, vegetarianism is actually like. And we might think that on this ground, there's a problem with premise 1. The Nazis practiced euthanasia. Well, we might even challenge premise 2 on the grounds that if you're trying to murder somebody with the motivation of exterminating them, that is not euthanasia, right? Euthanasia is a practice of intentional killing, but it's aimed not at exterminating people, but it's aimed at benefiting them or improving their well-being, right? So we might deny the truth of premise 2. The important thing about sort of taking this logical approach with arguments is that it can help us get really clear about how and why we disagree with an argument that we oppose. And when we use this sort of structure for the arguments we're trying to advance ourselves, it gives us a way of honestly defending our argument and defending it in a rigorous step-by-step way. Here's another thing that we can do. Once we start making arguments, offering premises and reasons in favor of certain conclusions, we can start watching for fallacies in reasoning. So if you hear this word fallacy, what does it mean? Well, here's my rough and ready definition of what we're talking about when we talk about a fallacy. It's a common, but it's also a misleading and unreliable way of reasoning. So it's the idea that when people start making arguments, they get themselves trapped into certain bad moves of evaluating evidence and drawing conclusions. So here are some examples of fallacies in arguments. One is what's sometimes called the ad hominem argument. When you make an ad hominem argument, what you're doing is you're attacking the character or motives of those arguing. In fact, that's sort of like saying, well, you only believe that because you're a such and such, right? You only believe that because you're an atheist, or you only believe that because you were raised by people scared of the medical system, and so on and so forth, right? What's problematic about this is it's drawing us away from the evidence on the page. Instead, we sort of argue about whether this person has bias or whether this person is a good person. Much of the time, these questions about whether the person making the argument is a nice person, it's usually pretty irrelevant to the question of the argument that they're actually making. Now, here's another one. Dunn and Hope tell us that the argument from nature is a fallacy. Now, here's how an argument from nature might go much of the time. We'll stick to euthanasia for our example. We might say, well, so-and-so wants to receive euthanasia, but that would be unnatural. So therefore, we should not allow it. So we're arguing that something is unnatural and therefore morally wrong. The thing we need to notice here, though, is that this argument does not seem to be logically sound, because it seems like there are many unnatural things that we do that seem perfectly morally okay, right? You probably woke up using an alarm clock this morning. You showered instead of just jumping in a lake or waiting for the rain to wash your body. Those things are not simply letting nature take its course, but we think that those things are morally right. We might also notice that much of medicine is an attempt to interfere with nature, right? If you are taking a multivitamin or an antidepressant or even a painkiller, we might say, isn't that interfering with nature? That seems like a bad reason not to avail yourself of these medical technologies. There may well also be a problem of drawing a line around what's natural and what's unnatural, right? We might say, isn't it natural for human beings? Isn't it just right in our nature to keep figuring out new forms of technology? Well, if that's true, then like this iPhone is a natural thing. It emerged from a predictable series of human behavior. So in this way, the argument from nature is not a very good way of critiquing things within the realm of medical ethics. Now, we also get an argument which we might call the argument from playing God. So this might be the argument that we'll sometimes encounter in the context of euthanasia. It might say something like this. Well, so-and-so, say Ms. Boys, wants euthanasia from Dr. Cox, but Dr. Cox can't do that, because to do so would be to play God, right? We might say God has the right to take people out of existence to bring about their deaths, but Dr. Cox does not. Well, again, we might get some questions here. Are we playing God when we lengthen a person's life by removing a cancerous tumor from their body? Or are we playing God when we ourselves decide not to receive another round of chemotherapy? Well, people might say, maybe you have the right to do those, but what we're saying is with euthanasia, only God has the right to perform those actions. Now, it already seems a little confusing here because, and this would be the question that we should ask a person when they're making an argument from playing God. Why is it that withdrawing or withholding care is an acceptable decision for patients and doctors to make, but it's not an acceptable option for patients and doctors to make when we're talking about euthanasia? Well, the problem here is that once we start thinking about it in this way, well, we'd say, well, it's the stuff that God doesn't want you to do yourself. But here's the problem, as Dunn and Hope put it, and I think that they've gotten something important here. You can't know God wouldn't want you to do something until you know what's right and wrong first. And you might even think, look, if there's nothing morally wrong with performing active euthanasia, just like there's perhaps nothing morally wrong with taking a painkiller when your arm is hurting, well, we might say, if those are both perfectly okay things to do, then God wouldn't have a problem with your doing them. But here's the problem. With this argument from playing God, you don't know what's playing God. That is, you don't know what only God gets to do until you do some reasoning about what's right and wrong in the first place. right? Because if something is okay, if it's right, if it's permissible to do, then God wouldn't have a problem with you doing it. But that means we have to figure out what's right and wrong first, before we figure out what God is going to tell us to do. Okay? But this means that to make an argument from playing God is a way of saying, well, euthanasia is wrong because it's wrong. We can call that a circular argument, or we can call that an argument that begs the question. When philosophers talk about begging the question, we're talking about a person making an argument that's assuming the conclusion, sometimes in subtle ways, but they're assuming the conclusion of what they're trying to establish in the first place. So we might say that an argument from playing God is, in fact, a certain way of begging the question. If somebody tells you that something is playing God, you should ask that person questions back until you realize, and in most cases you will realize, that this is a subtle way of making a circular argument. That's how Dunn and Hope think about these arguments from playing God. Now, I don't want to give you the wrong impression. Dunn and Hope are not saying that there is no God, and they're not saying that religion should have no relevance within medical ethics. In fact, within medical ethics, an important skill that providers need to be mindful of and that philosophers should be respectful of is the fact that people's religious liberties and preferences should be respected within healthcare. So it's not as if religion has no place within the reasoning of healthcare, but we also need to realize that we cannot simply say playing God, or that my particular book of scripture says that this is wrong. That might be a perfectly legitimate reason for an individual to refuse treatment, but as a broader argument that we're having with the public at large, irrespective of their religious views, arguments from playing God won't get you very far. So there are many different examples of fallacious arguments. I've just mentioned 3 that come out in our textbook. But you might check out this fun little book called The Illustrated Book of Bad Arguments by Eli Amasawi. And this book sort of runs through all sorts of ways in which people reason in fallacious ways. That is, a bit too quickly and a bit too sloppy. So you've got to be careful about these things. So I recommend that you do some further looking into how you can avoid making bad arguments yourself. Here's another form of argument that Dunn and Hope think we need to talk about: slippery slope arguments. Sometimes slippery slope arguments are classed right in the middle of a list of fallacies. That's not how Dunn and Hope are going to think about them. They are going to point out that there are certain kinds of arguments that are slippery slope arguments that are problematic. So they call this one a logical slippery slope argument. They might say, if you accept proposition P, think of that as like a particular conclusion, you have to accept proposition Q. You might say, this is a proposition, this is another conclusion that's very similar. And if you accept Q, you have to accept R, and if you accept R, then you have to accept S, and so on and so forth, until you're committed to accepting an unacceptable claim. So it's trying to say, logically speaking, you are required to make an absurd conclusion. So here's an example. If you have to allow euthanasia when a person has 6 months left to live, then you have to allow it when a person has 6 months and a day to live. And if you should allow it when you can expect 6 months and a day, then why not 2 days? And if not 2 days, then 3 days. And if you run this argument for long enough, then you could say, well, if a person has 100 years left to live, then they should be allowed euthanasia. But, at this point in my life, I'm 36. I have less than 100 years left to live. But it doesn't seem like I am a terminal patient in that sense. So Dunn and Hope say that this form of reasoning is fallacious. So they're going to say that this form of reasoning involves a certain kind of logical trickery. And in a certain way, it's making a certain kind of slippery slope argument. But they're going to distinguish it from an empirical slippery slope argument. This is an argument that says bad things will happen if we change something or adopt a new policy. In fact, this was the kind of argument that Leon Kass was making against euthanasia. And this argument is just saying, if we do this one thing, something else bad will happen. So the way that Kass put it is, if we legalize euthanasia, it will lead to a deterioration of the doctor-patient relationship. And when we encounter these arguments, we can't just blow them off, right? Sometimes an empirical slippery slope argument is a good one. You probably believe that certain slippery slope arguments are true. But what we want to ask is there evidence that doing one thing, like legalizing euthanasia, will lead to the bad thing, a deterioration of the doctor-patient relationship? We might also ask about whether there are ways of preventing slippage from the one thing to the other thing. So, for instance, in Peter Singer's defense of euthanasia, he will point out to us that there are certain laws in place that make it so that doctors can't just euthanize people whenever they feel like it, but instead they can only euthanize people after filling out certain forms, after getting them checked on by other impartial parties, and so on. And the thought there is, well, maybe we could critique the argument by saying, look, we can do this one thing without getting to the bad result. Now, in this way, we want to ask these questions to see whether the slippery slope argument is actually one worthy of our belief. So that's another philosophical skill, in the sense that when it comes to slippery slope arguments, sometimes they are a fallacy and sometimes they are not. And the questions we want to ask: is there evidence? Are there ways of preventing the logical connection from the initiating event to the bad thing in the future? And sometimes we need to ask the question, is the projected outcome really as bad as some people are making it out to be? It seems like the deterioration of the doctor-patient relationship would be a terrible thing to lose, but sometimes slippery slope arguments are made where the alleged terrible thing isn't really that bad. For instance, people might argue that a certain change would lead to a reconsideration of our entire value system. Well, some people advocating for the change might say, yeah, that's exactly what we're going for here. All right. Now, here's one last thing that we can do in the realm of philosophical reasoning. We can also use a thought experiment. Now, philosophers use thought experiments as ways of testing principles, or ways of generating intuitions that we can then use to generate principles and understand our ethical reasoning a bit more clearly. So here is a famous thought experiment from philosophy. And this is sometimes called a trolley example. So here's the case. There's a runaway trolley barreling down the railway tracks. And ahead on the tracks, there are 5 people. These 4 unlucky souls right here. The trolley is headed straight for them. And you are standing some distance off in the yard. And you're next to a lever. And if you were to pull this lever, the trolley would switch to a different set of tracks. So it would go away from the 5 people and go towards this one. Yeah, so unfortunately, there is one person there. So you have 2 options here. You could either do nothing, not pull the lever, and you would let the 5 die, or you could pull the lever and it would divert the trolley onto the side track where it would kill this one person. Now, what we can do is we could say, what would the right thing to do here be? You can think to yourself for that about a second. But most people, their gut reaction says, you should pull the switch, right? And when we ask folks why they would pull the switch, the common answer is, well, because it's better for one person to die than for 5 people to die. And on the basis of that line of reasoning, we might actually be able to generate a philosophical principle, or at least realize that one thing that we want to do when we're thinking ethically is make sure to maximize good results. Or we might say we want to avoid allowing harm to come to people. And we might say, look, it's just better for 5 people to live than for 1 person to live. And on that basis, we might think that we could use that principle that underlies this case to think about other cases in medicine, right? If you want to figure out, say, which drug to fund at your hospital, if you realize that, well, drug A could save 1 person's life, but drug B could save 5 people's lives, and you only have the money to fund 1 drug, well, the principle that we've drawn out of this case might tell us that, well, it would be better to put the money towards the more effectively life-saving drug. So that's what we're doing with thought experiments. Sometimes these thought experiments are outlandish or a little bit hypothetical. Sometimes in these thought experiments, we know more than a person could really expect to know. But we use the thought experiment to think more clearly about principles. Now, this is also going to lead us into my discussion for the next video, which is a theory of ethics called consequentialism. It's a theory that's all about aiming for the best outcome. So we'll start to think a little bit more about that theory of ethics in the next video. So thanks for watching this one, and in the meantime, be well.